You know, I'm married to a nurse, so I respect the profession and I see the work, and I see the dedication, I see the professionalism, and I see, for lack of a better way of putting it, the calling. Most nurses knew they wanted to be nurses at a very, very young age, and it's work. It's a lot of work. I want to bring Becky Nelson in. She's nurse and chair of the Minnesota Nursing Association's Government Affairs Commission, and they've got a lot of things going on that we want to get a chance to visit with Becky about. Becky, good to have you coming down the road with us.
Thank you so much for having me.
You were the MC of the roundtable yesterday that looked at the report, looked at what's going on. I think the best thing we can do in our conversation here is really lay out what's going on in the nursing field, what's being asked, what the numbers are, because when I look through some of the notes here, some of it surprised me. I didn't know some of this. So if you could lay some foundation for me, Becky, would you?
Sure. So the report that we released with this week is called Why We Left, the 2022 Nursing Workforce Report. And what we did is we surveyed approximately 250 Minnesota Nurses Association members that have left the bedside within the last 2 years. So this is during the course of the pandemic. What we found out is that folks were not leaving because of the pandemic, which is the current narrative in the news. Why we are leaving is because of issues that we've always had in the hospital, which include hospital management, the corporate environment, and short staffing. Those are the nurses' biggest issues. They're chronic issues. And the pandemic certainly was another stressor on top of all of it, but it really just laid the chronic problems wide open and bare. There's plenty of nurses to go around. The nursing shortage that the hospital cries just isn't true. We've increased the amount of nurses in the state via our education systems. We've got more nurses licensed in the state of Minnesota than we have had ever. They just don't want to work in the hospitals anymore with what they're putting us through.
You said the problems were there prior to the pandemic. Don't doubt it. Don't doubt it one bit. But I have to ask, I should say, was it the pandemic that showed they didn't need it? That there is life beyond being a nurse and being treated well in whatever new life you might enter into? Was that part of it, and the pandemic just showed that?
I think that could be part of it. We have been working, just by the last hair, right? For a long time. There's always a stress. There's always some issue that you encounter every single day as a nurse where you don't either have enough supplies, you don't have enough staff, you're being asked to do something that isn't in your scope or isn't something that you were trained to do or required to do it. You're being asked to work in an area that you're not used to. And then on top of this, all of a sudden we have this virus. In the beginning, we didn't even know what it was or how it was transmitted. And I think there was some fear. There's a small percentage of nurses that did have some COVID fear and reported leaving because of the pandemic. But we're talking like 1 in 20. Okay. The vast majority said that was not the big issue. We are trained to deal with infectious diseases. We are not trained to deal with infectious diseases without adequate protective equipment or adequate standards to do so.
So, Becky, why? I mean, we've seen healthcare providers consolidate, get bigger. We've seen record profits. We've seen them go out and beg for doctors. We've seen doctors leave some of the big health organizations because they've had it as well. Why are nurses being treated the way they're being treated? Are they just being taken for granted, or what is it that's caused people in your profession that are licensed to practice in your profession to say they don't want to be in the profession?
Well, I mean, that is absolutely individual for every single nurse. I will say that on our survey, what big complaints were lack of response from management with regards to patient safety concerns. So nurses are feeling like they're walking into work and not being able to provide safe care. That leads to things like what we call moral distress, where you're feeling like a failure at work for a situation that's really beyond your control. Just generalized poor management in the unit, maybe skill mix is bad, toxic culture, meaning because of the stress, healthcare workers are turning on each other instead of, taking it to the up the chain or to the correct person. There's just a general sense of not feeling valued by the organization.
So everything you just described back in my days as a state senator would have me ripping my hair out because I wouldn't even know how to fix it. I mean, I wouldn't. I'd be sitting there going, my answer to all of this when it comes to nursing, and the number that jumped out at me in our conversation here was over the past 3 years, bringing that total up to 120,000 nurses. You have nurses. That's what you've proven in this study and just sheerly by numbers. And so, as politicians, oftentimes we're like, okay, lower the standard when it comes to being a nurse, produce more nurses, go into the high schools, get it going, start at the LPN level and turn out a bunch of LPNs. I don't see that fixing this.
No.
So I guess I ask you, Becky, if we were in a room and we were going to try to fix this as a state policy maker, what would you tell me to do?
Well, the biggest thing that really needs to be done is we just need to have the amount of work that we are able to be assigned legislated. We have to be able to have a maximum patient assignment. There are professional standards for this. The hospitals know it. The hospitals set their own standards. They have their own grids, with how many patients a nurse should be taking care of at this acuity level and whatnot. And oftentimes when push comes to shove and they've got more patients coming into the hospital than they can handle, we're just asked to do more. We're asked to do more. We know it's not safe. So that would be the biggest thing. And the other big issue is just the profit model of the current system. We are constantly shorted. My supply closet never has enough stuff in it. It's just obvious that they are really running the whole entire organization extremely, extremely lean if you work in that environment. Instead of having things at our fingertips, we have to make 15 calls looking for the things that we need to do our job.
So obviously, where I'd be. I'd be an advocate on behalf of the nurses, but lost in all of this is the conversation of why you're doing what you're doing in the first place. How bad is the patient, the individual in need of your services, paying a price for all this?
They are paying a price for it. And I think, I'm going to just point to my own experience when I was a healthcare consumer within the last 6 weeks. My son had, a gym class injury. He had a concussion. We ended up going to the emergency room. We were sent home. We ended up going back to the hospital 2 days later because he had some very concerning neurologic problems. Like he fell a couple times at home, was having weakness on one side of his body. So we went back to the children's hospital and they ran a whole bunch of tests and they said, well, we can't figure out what's wrong with him, ma'am. I think we're going to have to admit your son. And I'm like, okay, well, that's fine. We'll do that. Well, guess what? I sat in the emergency room my entire admission, the whole time. It was not quite 24 hours, but we were supposed to get a bed upstairs on the hospital ward. And I sat there in the emergency room with my son, sleeping on a stretcher. So, and I was likely, I haven't fine-tooth combed my bills yet, but I'm quite certain I was billed for a hospital room. So it's just that kind of monkey business, that they didn't have enough nurses they either didn't have enough nurses upstairs or they didn't have enough physical space. So the physical space issue is definitely the hospital's problem. That's a management problem.
I would guess that if I spoke to a number of other states, it'd be an echo of what you're saying. And before I let you go, I've got to ask you, how is your son now?
He's doing much better. We're still doing a little bit of therapy, but he's made a lot of progress and we're going to be fine.
Well, keep fighting on behalf of nurses. We desperately need them. And like I said, I'm married to one, so I know how hard they work. So I appreciate it, Becky.
Yeah, thank you for highlighting our report. It's good to talk to you.